Hello, everyone. Welcome back to the Road to Pregnancy podcast, where we provide you with pregnancy related information and local accessible resources here in Rhode Island. I'm one of your co hosts, Malia Perales.
And I'm Ashley Houlihan. Today's episode is a deep dive into a topic that can feel really overwhelming when you first hear the diagnosis: gestational diabetes.
Yes, if you were recently told you failed your glucose test or just got diagnosed with gestational diabetes and are spiraling a little bit, this episode is for you.
Take a deep breath. We're going to walk you through what it is, why it happens, what the testing means, how to manage it, and what it means for you and your baby. If you haven't been diagnosed with gestational diabetes and simply want to learn more, we hope you learn a lot from this episode. Okay, Malia, let's start simple. What is gestational diabetes?
So, gestational diabetes, also called GDM, is a type of diabetes that develops only during pregnancy. Diabetes mellitus is a condition where too much sugar stays in your blood instead of being transported into your cells to be used for energy. When that first shows up during pregnancy, we call it gestational diabetes. You may know someone with or have heard of type 1 and type 2 diabetes. Gestational diabetes is in its own category diagnosed in pregnancy.
So, just to be clear, this is different from someone who had diabetes before they got pregnant?
Yeah, exactly. Gestational diabetes develops during pregnancy, and it usually happens in the second trimester, which is why we're discussing it this season.
Got it. So, how common is it?
It's actually pretty common. Millions of women are diagnosed each year. Some groups are affected more often, including women of African, Asian, Hispanic, Native American, and Pacific Island descent, and also those who are older and those with a history of type 2 diabetes in their family.
So, if someone gets diagnosed, something they may ask themselves is, did I cause this?
And the answer is no, you did not cause this.
Yes, we really want you to know that you did not cause this.
Gestational diabetes happens because pregnancy hormones interfere with insulin, and insulin is the hormone that helps move sugar from your blood into your cells for energy.
And during pregnancy, those hormones rise a lot as the placenta grows.
Exactly. And so over time, these hormones make your body more and more resistant to insulin. Most women's bodies compensate by making more insulin, but in some patients, the pancreas, which is the organ that makes insulin, just can't keep up.
So, it's not because you ate too much sugar,
No,
not because you gained too much weight,
nope.
not because you did something wrong.
Exactly. This is about how your body responds to pregnancy hormones. And some people may have also had underlying insulin resistance before pregnancy that becomes unmasked with these hormonal changes.
Right. So let's talk about the glucose test because that is a test that really stresses people out.
It does. So, around 24 to 28 weeks, again, this is in your second trimester, most pregnant women will take a glucose screening test.
And that's the one where you drink the super sweet drink, right?
Yes, that first test is a screening test. So, you'll drink a sugary drink and your blood is drawn 1 hour later. You don't usually have to fast for this one, and a lot of people describe it as the worst drink ever or say they feel really sick afterwards, so you might hear that a lot.
And to be fair, it is very sweet. I've actually tried it before and it just tastes like a very sugary Gatorade. Some people say it tastes like a flat soda or syrup, and you can think of it as the same amount of sugar as drinking a 16-ounce bottle of Coke.
Some women feel a little bit nauseous, shaky, tired, or lightheaded after drinking this drink, especially during the longer 3 hour test when you are fasting.
But that doesn't necessarily mean that something is wrong.
Those feelings are usually temporary. The test is designed to briefly raise your blood sugar so that we can measure how your body responds.
And so, what happens if you fail that 1 hour glucose test?
Yeah, and first, I do want to acknowledge that the word fail can sound kind of harsh. It really just means that the amount of sugar in your blood after drinking this drink and waiting an hour was higher than the number that we'd like to see.
So, there's a specific cutoff number we're looking for.
Yes. And after you drink the sweet drink, they'll check your blood sugar 1 hour later, like I said. If your number is above that certain cutoff level, it means there's more sugar in your blood than there should be, which can signal to us that your body may be having a little bit of a harder time handling sugar and bringing it into your cells, as we discussed earlier.
But that doesn't automatically mean that you have gestational diabetes.
Right. The first test is just a screening test. Think of it like a first check. It's designed to catch anyone who might have gestational diabetes, and it only takes 1 hour. We do this so that we don't have to put everyone through the 3 hour test.
Exactly. And because it's better at catching possibilities rather than giving a definitive yes, it is possible to fail the 1 hour test and then go on to pass the 3 hour test. The second test gives a more detailed picture of how your body handles sugar over time.
Exactly. So, going back to your earlier question, Ashley, if you do get that call that you failed your 1 hour glucose test, it's not necessarily a diagnosis. It really just means let's double check.
If that number is elevated, you'll take the second test, the 3 hour glucose tolerance test. That one, you do need to be fasting, so no eating 8 to 14 hours before the test. They'll draw your blood before you drink the sugary drink, and then every hour for 3 hours after. If two or more of those values are high, meaning your body is struggling to bring glucose out of the blood and into your cells, that's when you're officially diagnosed with gestational diabetes.
One other thing I did want to note is that if your 1 hour blood sugar number comes back very high, like much higher than the cutoff, some providers may diagnose gestational diabetes right away without making you do the 3 hour test. But this isn't super common. Usually you'll move on to the 3 hour test as we discussed, but we just wanted to throw this in there just in case that's your experience.
That's a great point. So is the sugary drink safe?
Yes. Great question, Ashley, because that's a very valid question to ask about things you're putting into your body when you're pregnant. But the sugary drink is safe. It temporarily will raise your blood sugar so that we can measure how your body handles the sugar, but it is completely safe for you and your baby. Some women, as I said earlier, will feel nauseous or lightheaded after drinking it, but those feelings will pass.
Okay, so now if someone gets diagnosed, what actually changes and what happens next?
Great question. The main goal is to keep your blood sugar in a healthy range throughout your pregnancy. That usually involves making some changes to your diet, checking your blood sugar at home frequently, and sometimes moving forward with medication to manage your diabetes.
Let's start with food because that's what people panic about. Do you have to stop eating carbs if you get diagnosed with gestational diabetes?
No, carbs are not the enemy. Your body and your baby need carbohydrates. The goal, however, is balance and portion control. And balancing your carbs with other nutrients like proteins and fat can help reduce spikes in your blood sugar throughout the day.
So, what does that look like in real life?
Yeah, so a simple rule can look like this. Imagine a plate. Now, half of your plate will be vegetables, a quarter can be protein, and a quarter can be carbs.
So, to give you some more practical examples, breakfast could be scrambled eggs with whole wheat toast or Greek yogurt with nuts and a small portion of fruit. Lunch might be grilled chicken, brown rice, and broccoli, or a turkey sandwich on whole grain bread with a side salad. Dinner could be salmon with sweet potatoes and green beans, or ground turkey tacos with corn tortillas and veggies.
Thank you, Ashley. Those are some great options. And how about snacks?
Yeah, you could do an apple with peanut butter, cheese, and whole grain crackers, hard boiled eggs, or a handful of nuts.
And our episode on nutrition and pregnancy back in season 1 goes over a lot of relevant information and helpful advice for a healthy diet in pregnancy. We've also linked some very helpful resources and guides for a healthy diet in the show notes that come directly from the American Diabetes Association.
Exactly. So, moving forward with management, how often do patients with gestational diabetes have to check their blood sugar?
Great question. So, usually patients should be checking their blood sugar 4 times a day, typically while fasting in the morning and then either 1 hour or 2 hours after meals throughout the day.
And how do you actually check it?
Your provider will give you a small device called a glucose meter. You'll wash your hands, use a tiny needle called a lancet to prick the side of your fingertip, and place a small drop of blood onto a test strip. The meter will then read your blood sugar in just a few seconds and report to you back a number.
And most people say it's much less scary than it sounds.
Yeah, the needles are very small, and after a few days, it'll become part of your routine. And what numbers are we looking for, Ashley?
So the target levels for glucose can vary from person to person, but we typically want to see a fasting level under 95 and levels under 140 an hour after meals or under 120 2 hours after meals. Your provider will give you more specific information when you meet with them.
And what if one of the numbers is high?
So one number is not a crisis. We'll look at patterns over time. You want to write these values down or log them in an app and bring them to your appointment so your provider can look for those patterns.
Another thing to talk about is insulin. Some people get concerned that if diet isn't enough, they'll have to start insulin. And sometimes that is the case. And that's okay. Insulin is the recommended medication in pregnancy because it doesn't cross the placenta, meaning it doesn't reach the baby.
Yes, and as the placenta grows, insulin resistance increases, so needing higher doses over time is normal. Your glucose log will be super important in helping your provider make adjustments to your doses throughout pregnancy.
And taking insulin really just means that your body needs some extra support. It can seem intimidating at first, but your provider will teach you exactly how to use it safely and confidently. The needles are very small, and most women say that the insulin injections are much easier than they expected. It's simply a tool to help keep your blood sugar in a healthy range and protect both you and your baby.
That's a great way to put it, Malia. Okay, so let's talk about the baby. What happens if gestational diabetes is not controlled?
Great question. If gestational diabetes is not well controlled, extra sugar ends up crossing the placenta to the baby. The baby will then make extra insulin to manage it, and that can cause the baby to grow larger than average, meaning a baby born over about 8.5 to 9 pounds.
And what happens if someone has a bigger baby?
Well, there's a higher risk of shoulder injury during vaginal delivery, an increased chance of a C section, low blood sugar in the baby after birth, higher chances of things like breathing issues, and a possible NICU stay. After birth, the baby's blood sugar will be checked, and if it's low, it's usually treated quickly with feeding or sometimes IV sugar.
And we know that hearing about complications can definitely sound scary.
It can. I think anytime we talk about risks in pregnancy, it feels very heavy.
Totally. But I think the really important thing to emphasize here is that these risks are mostly associated with uncontrolled blood sugar.
Exactly. When blood sugars are well managed, outcomes are usually very good. Good control dramatically reduces those risks.
So, this diagnosis is not a guarantee that something bad is going to happen.
Not at all. The majority of women with well controlled gestational diabetes go on to have healthy pregnancies and healthy babies.
Let's talk delivery for a second, because I know people immediately think, does this mean I'm getting induced?
Right, or am I automatically getting a C section?
And truthfully, the answer is it depends.
Yeah, if blood sugars are well controlled and everything looks good, many providers recommend delivery around 39 to 40 weeks. But if blood sugars are harder to control, sometimes delivery is recommended earlier.
And in terms of C-section, many women with gestational diabetes still deliver vaginally. It's very individualized. There isn't a one size fits all rule. All right, so let's fast forward to after the baby's born. What happens then?
For most women, blood sugar levels return to normal within days to weeks after delivery. That's because once the placenta is delivered, those pregnancy hormones that were causing insulin resistance are gone.
Which is very reassuring.
Exactly. But that's not necessarily the end of the story.
Right. Follow up is really important.
Now, we recommend that most people do a 2-hour glucose tolerance test before leaving the hospital after delivering the baby. So, this can be postpartum day 1 or 2. If you're unable to do it at that time, then it should be done within 4 to 12 weeks postpartum to make sure your blood sugar has normalized. And even if it has, you're still not totally off the hook.
Yes, because women who have had gestational diabetes are at a higher risk of developing type 2 diabetes later in life. And that risk range is somewhere between 15 and 70%.
And that risk range does sound very wide, but it really depends on other factors like weight, activity level, family history, and future pregnancies.
So, this is where prevention becomes empowering.
Exactly.
So, what can someone actually do to lower their future risk?
Small, consistent lifestyle habits make a huge difference. Walking about 30 minutes most days, eating balanced meals with fiber and protein, and maintaining a healthy weight are some examples.
Breastfeeding can also help to reduce the risk of developing type 2 diabetes, which is another wonderful benefit of breastfeeding that a lot of people don't know.
Yeah, and again, staying up to date with regular diabetes screening is super important to catch anything early. We should also talk about baby's long term health.
Yes, that's super important for parents to know about.
So, children born to moms with gestational diabetes do have a higher risk of obesity and diabetes later in life.
But that does not mean that it will happen.
Not at all. Healthy family habits, balanced meals, physical activity, limiting sugary drinks all can significantly reduce that risk.
It's all about setting the tone for lifelong health. I also just want to take a minute to acknowledge the emotional side of this.
Yeah, a diagnosis like this can bring up guilt, anxiety, even shame.
Yes, and as we said earlier, this is not your fault, and you shouldn't feel ashamed by any means. But those feelings are still valid. So, what helps?
Asking questions at appointments, meeting with a dietitian or a diabetes educator if that's available, joining support groups, even just going for daily walks to clear your head. All of these are some ways to help you manage and cope with this diagnosis.
And keep in mind that this is temporary and it is manageable. So, now maybe we should do some rapid fire myths.
Yes, let's do it.
Here's one. I caused this by eating too much sugar.
False. As we said, gestational diabetes is caused by pregnancy hormones, making your body more resistant to insulin. It's about how your body responds to pregnancy, not about how much sugar you ate.
I can never eat carbs again.
Also false. Carbohydrates are important for both you and your baby. The goal is not eliminating carbs, it's choosing healthier carbs, watching your portions, and pairing them with protein and fiber to prevent those spikes in your blood sugar.
How about this thought that some women may have? If I need insulin, I failed.
Absolutely not. Some bodies just need extra support. As the placenta grows, insulin resistance increases, and that's normal. Insulin is simply a safe and effective tool to protect you and your baby. Studies have even shown that patients feel less stressed about their GDM once they start medications to control it.
Some people also think that if they have GDM, that their baby will definitely get diabetes.
And again, that's not true. As we talked about earlier, having gestational diabetes does increase your child's risk slightly, but it does not guarantee anything. Healthy lifestyle habits throughout childhood can significantly lower that risk.
Okay, last one since it's so common. Gestational diabetes isn't a big deal.
Yeah, and that one's tricky. It can become serious if it's not treated, but when it's diagnosed and managed properly, most women do go on to have completely healthy pregnancies and babies.
If you're taking anything away from this episode, let it be this. Take gestational diabetes seriously, but don't panic. This diagnosis does not define your pregnancy, and it's something you can manage with the right support and team.
Exactly. So today we walked through what gestational diabetes is, why it happens, what the testing process means, how it's managed, and what it means for your delivery, and also what happens after pregnancy.
If you were recently diagnosed, we hope this helped you feel informed instead of afraid.
This is common, it's treatable, and you are not alone.
As always, we'll link evidence based resources in our show notes, including guidance from ACOG and the American Diabetes Association.
You can also follow us on Instagram at Road to Pregnancy for more pregnancy education.
Thank you so much for listening, and we will see
See
you
you next
next
time.
time.